We've all heard the saying that you can't solve a problem by enabling it. Yet across Canada, supervised consumption sites are doing exactly that, giving people a place to use illegal drugs under government supervision. These sites allow people to use substances like fentanyl and cocaine with clean supplies and medical staff nearby in case of overdose. Supporters say that this saves lives, and I agree completely, but I also believe that it crosses a seriously dangerous line. Supervised consumption sites should not be permitted because they normalize drug use, create safety and legal issues, and take resources away from real recovery and prevention. According to Health Canada and Canadian Centre on Substance Use and Addiction, these sites are meant to prevent overdose, deaths, and connect clients to health or social services. But the data shows that they only reach a small group of people. For example, Vancouver's Insight supervises only about 5% of injections in that area, meaning 95% are still using drugs, but it's happening elsewhere unsupervised. That means that we're not actually reducing addiction or overdoses overall. We're just moving some of them indoors. And when we provide a safe space, medical setting to use illegal drugs, we risk sending the message that drug use is something that's okay and that society accepts rather than challenging it. Supporters often say that these sites make communities feel safer, but when we look around, we still see the same problems: open drug use, discarded needles, and growing public concern, in which I don't feel safe in. Instead of protecting neighborhoods, these sites can actually draw more drug activity into the struggling areas already. Families, children, and local businesses are the ones that have to deal with these effects every day. And then there's the question of fairness. If I were caught on the street with an illegal drug, I'd likely face legal consequences. But instead, inside of one of these sites, the same substance can be used freely, under government supervision and with taxpayer funding. That's a double standard, and I don't think that we can criminalize drug use in one place and allow it in another. It sends a confusing message about what's really acceptable and what isn't, and it puts healthcare workers in the middle of a moral conflict that shouldn't exist. Even health authorities admit how serious addiction can be. The Government of Canada says that drug use affects work, relationships, finance, and mental health, and there's even more. And that people build tolerance, needing more and more of the drug just to feel normal. But what's really concerning is what is allowed in some of these programs. Vancouver Coastal Health Overdose Prevention Manual says that staff can assist people with injecting if they can't do it themselves, even though the drugs are illegal. It also says that staff must handle and dispose of the leftover substances, meaning healthcare workers are literally dealing with illegal drugs as part of their job. The manual even mentions that outdoor areas where people can smoke drugs instead of injecting them, while acknowledging the risk of overdose is still high and likely very fatal when you smoke something. So not only are these sites enabling drug use, but they're also expanding it into different forms. Vancouver Coastal Health also posted a public pamphlet online called Safer Injecting, and it shows a step-by-step instruction guide on how to inject drugs like cocaine or fentanyl, and anyone can access this, which is a growing concern for me. Even though the goal might be to reduce harm, putting those guides online for anyone to see, including kids or teens, crosses a serious line. As a future nurse, I believe that healthcare should focus on helping people heal, not teaching them how to use a dangerous substance more safely. Keeping people alive really matters, but we also need to actually help them get better. These programs cost them money, a lot of money. They need trained staff, clean medical supplies, and ongoing funding, all paid for by taxpayers. The CCSA says that there might be cost savings if people use treatment services afterwards, but that doesn't always happen. Many people are going to keep coming back for months or even years without ever moving towards recovery. Every dollar spent on keeping these facilities open could instead support mental health care, detox programs, and long-term treatment, things that will actually help people get back and rebuild their lives. In healthcare, we're taught to do no harm, but letting people inject illegal drugs under supervision or posting instructions online on how to use doesn't feel like care. I think it really blurs the line between compassion and enabling. Supervised consumption sites might reduce harm inside their walls, but the crisis outside still continues, like overdoses, trauma, and broken families and broken people. We can't solve addiction by making it safer to stay addicted. Instead of putting money into sites that normalize drug use, Canada should focus on detox, mental health services, and long-term rehabilitation. We need to remember that I think that we've lost sight of what care truly means.